speaker series. I'm Ginny Bowbrick and I'm a consultant vascular surgeon here at Medway. We're very lucky today to be joined by Annie Coleridge, who's the Chief Executive, and Dr. Katie Baker, who's the GP and Medical Director of Alva. Alva is a digital platform to support women with the menopause care and gives every woman the care that they deserve. Katie and Annie will be giving a short presentation and then the floor will be open to you all to ask questions. Today's webinar is why we need to talk about the menopause. And we'll be discussing how women experience the menopause and the impact it can have on women's work and their home lives. The Medway Innovation Institute has established these big conversations webinars to inform and stimulate discussions on topical subjects. And I'm reminded that in the last big conversation where I was a panel member, Harvey McEnroe was the host, and he started off his discussion with how he was connected with the topic, which was leftism. So my connection is, well, I'm a woman of a certain age and I'm menopausal. And menopause has not been what I thought it was going to be like. I don't really think I knew what I was going to expect by it. Hot flushes, waves of anxiety, these happening when you're scrubbed up by a bear hugger under lights in an operating theatre and now under PPE, pretty horrendous, and really impact on your ability to function day to day and to work. And I was sitting in a meeting with Jack having a hot flush. And I think at that point, I said to him, we need to discuss this because it affects so many people, and he agreed. Hence why we've had this big conversation. Since that initial discussion, Jenny Chong, who's an associate non-executive director at Medway, has really got behind this to push this agenda forward and has done some number crunching. And I was very surprised when she said that 80% of the workforce here are women. And of those, statistically, 23% are perimenopausal, 35%, which is 1 in 3 of us, are menopausal, and 7% are postmenopausal. So this topic affects 58% of the women who work at this trust, which represents 52% of the entire workforce. And there is a menopause policy at Medway, which I hadn't seen until we started the discussion, and allows for you to go and discuss this with your line managers, although I'm not sure how many of us would feel comfortable to do that given the stigma that's attached to being menopausal. And the reality is that this is a potential workforce issue in the same way that maternity leave and less than full-time working can cause a workforce problems at the moment. As we now near the end of our career, there's another workforce issue looming as we all become menopausal and have the symptoms requiring help with those. I didn't know that until last Friday that at Medway we have an accredited menopause specialist. There are 143 in the country, and Ms. Sharon Griffin, who's one of our obstetric and gynaecology consultants, is one of these, and she has registered Medway as a menopause specialist service. So we're certainly going to be pulling on her expertise in the future with Jenny, and that will be beyond me just cornering her in the coffee room to ask for some help and advice. So without saying anything further, I'd like to hand over to Annie and Katie to introduce themselves and to give us their presentation, please, at the end of which we'll be able to take questions from you. Thank you.
Hi, thank you so much for having us here today. We're both really thrilled to be a part of this opening up the discussion about menopause, especially in a trust that actually has a menopause policy and is a registered specialist service. It's great that you'll be able to pull on those resources following on this conversation and kind of keep the topic moving. So I'm Annie, I'm the co-founder of Alva, a business I started a year ago with someone I met in a previous healthcare startup called Phil. And I'll let Katie introduce herself quickly before we jump in.
Thank you, Annie. Hi, I'm Katie Baker. I'm the medical director at Alva and I'm an NHS GP by training.
Great. Can we go on to the first slide? Perfect. So if we move on to the next one, I'll just introduce Alva and our mission. But I think the important thing is we're not here to talk about Alva today. We're here to talk about menopause and how it affects women. And we're not assuming any knowledge of menopause because although, 58% of the women in your trust right now might be in some way experiencing menopause, we really believe that every single person experiences menopause in some way or another, be it through a partner, directly themselves, through their parents, or through their friends. And we think by making menopause easier for women, we can actually help everyone kind of through this transition. So Alva's mission is to reduce menopause suffering and enable women to live longer in good health, as menopause is really a kind of inflection point, if you think about it, in the middle of a woman's life, where they can kind of make positive steps to kind of live the second act, if you like, in better health. And what we're creating is a digital health platform to support women through menopause with really personalised insights and ongoing support throughout the transition. So can we have the next slide, please? So by 2025, over 1 billion women will be menopausal. So it's not a small problem within the population. And it's important to highlight that not all women will have symptoms of menopause, but actually 80% will have some symptoms. And for half of those women, roughly, these symptoms can really be quite debilitating. And what we find is that most people associate the hot flush with menopause, but actually there's a lot more to it in terms of mental and physical health symptoms. And some of the mental health symptoms sometimes appear earlier in perimenopause. So things like really unexplained anxiety that comes on in waves, poor sleep, and then low mood, as well as some others that Katie's going to go on to discuss. And these symptoms aren't a short-lived thing. You know, the medium time in which women will experience symptoms is 7 years, and that's kind of both sides of the average age of 51, which is the average age of menopause in the UK. And some women, unfortunately, will have longer-lasting symptoms for sort of 10 to 15 years. So we're not talking about, you know, a year that women can kind of grin and bear it through. We're talking about, you know, a phase in women's lives which needs to be kind of talked about and given more attention than it currently has. Handing over to Katie for the next slide.
Thank you, Annie. So I thought I'd just take a step back because once you start kind of reading about menopause and getting more kind of clued up on menopause, it's easy to slip into assuming that everyone knows what menopause is. So menopause is actually just a day in a woman's life where she has not had periods for 12 months. But there's a whole, like Annie explained, period around this time where someone can experience symptoms. So the run up to menopause is called the perimenopause, and this is where women's periods can become more irregular. They can get heavier periods, but also there's a whole multitude of symptoms. There's actually 34 symptoms which are thought to be related to the menopausal transition. So you can get symptoms in the perimenopause, which is the lead up to the day where you've not had periods for 12 months. And you can also get symptoms following on from that, which is called the post-menopausal phase. And this slide is really just trying to show kind of some of those symptoms. It's not even all of the 34 symptoms. And I've found often women don't associate some of these symptoms with the menopause. So things like headaches, or lots of women get increased anxiety, so feel like they can't be out in social situations anymore, kind of get worried about even driving their car to work, for example, and think there's so many other things going on in a woman's life at this point that it can easily be put down to, you know, the multiple other stresses that are going on. But I think it's really important for people to become more aware that these symptoms are can be due to going through the change of menopause, because then we can actually do something about it. And obviously all of these things can affect how you live your life. Particularly, I think the psychological symptoms are things that aren't touched on so much. So, you know, I found that women are more comfortable sometimes talking about their hot flushes or their night sweats, which they often associate with menopause. But some of the other things like decreased sex drive or increased anxiety or losing concentration in meetings are some things that aren't spoken about as much. So they're the things kind of which I think are quite important to open the conversation up about. Next slide, please.
Yeah, and back to me. So this is just really to illustrate the kinds of emails we get from people out of the blue, just telling us what their experience of menopause is. And this one highlights some problems within the space that are quite common. So, you know, a woman turning 50, she doesn't really know what's going on with her body, but suddenly is hugely struggling with mood swings and feeling very tearful and it's just completely unexplained. And I think like that kind of unexplained mental health symptom is something that we've heard time and time again from the hundreds of women we've spoken to at Alva. And then, you know, she mentioned some other symptoms that kind of lesser known. So things like joint pain, which is really common, but again, people don't necessarily associate joint pain with hormonal changes. And feeling, you know, really old, all of a sudden, you know, going from being someone in the middle of their life to feeling a little bit old and very different, and all of the kind of emotions that come with feeling older. And then, you know, in the last sentence, basically saying, I don't really know the options that are available to me. What should I be thinking about? Can you help me kind of work out the next step? And I think this email kind of captures some of the systemic issues that Katie's going to talk about in the next slide.
Yeah, so again, drawing upon what Annie has said from talking to women at Alva, but also what we see in clinical practice, what we know is that there's a lack of awareness around what menopause itself is, what to expect, how to deal with it. Then you've got the compounded barrier to access, which has been happening, and then that overall leads to actually poor treatment of the symptoms, if that's what's required at the time. So if the women kind of that we've spoken to through Alva, 90% couldn't actually say whether they'd been through the menopause or not, and weren't quite sure of what that actually meant. Fortunately, the other stat around awareness and education is improved. So there were previously no mentions of menopause in the national curriculum, and actually in 2020 that's been a change. So menopause is now going to be included in the curriculum, which I think is a great change for young women. There was an article that's been shown quite a lot, actually at the beginning of this pandemic, about younger women. So a woman as young as 13 had gone through the menopause. So I think it is really important to raise awareness from a younger age, just to know and kind of be prepared for it, and also support people through it. Moving on to barriers to access. So the Royal College of Obstetrics and Gynecologists found that 58% of women don't have any local access to menopause services. I think the British Menopause Society are doing a really great job of improving training for menopause specialists at the moment, and trying to improve that access. And there's 29 NHS clinics with a 6-month waiting time, which obviously varies around the country. Like some places have much better access than that at the moment. I know from the practices that I've worked at in London, there was often kind of a six-week wait to see a GP who was kind of more clued up, I would say, on menopausal treatment. So even kind of within local GP practices, there is the waiting time. And then that kind of, it's also adds into the poor adoption of treatment. So not many people are aware of the fact that cognitive behavioural therapy, specifically for menopause, can be really effective. And certainly within, you know, my colleagues who are also GPs and myself, like that actually wasn't well known, and there's not that much training on it. And a study also showed that 10% of women who were eligible for HRT are on it. So that's actually a huge proportion of women who could be able to take it and could benefit from it that are actually not getting that treatment. So yeah, we want to try and change this and yeah, improve it basically. But next slide.
Yeah, so as part of what we've done at Alva is we have a sort of menopause assessment on our current site, and since launching it in January, we've had over 32,000 women complete it. And the idea of this really came from speaking to women directly about menopause, and me just being completely shocked by them not being able to answer that question, are you before or after menopause? I thought, like, although it's not simple, it should be something that women have access to and information about. So we developed quite a high level assessment initially to really give women an idea of where they're at, what that stage means, and some personalised information after that. And the uptake has been, you know, frankly astounding. And I think what that shows is women are trying to find information about this, you know, turning to Dr. Google and, you know, anyone that they are comfortable talking to this topic about, talking about this topic to. And what we've found from that data is that, interestingly, the kind of symptoms for induced menopause match most of the research. So that's like, you know, hot flushes are the most common symptom. They're the most impactful. Then you see things like night sweats and brain fog coming in after that, and sleep issues. And that kind of makes sense because a lot of the research on menopause is based on those women who are in a kind of clinical setting and who have had an induced menopause, which is something that can happen from a medical treatment, like some treatments for cancer, or from having your ovaries surgically removed for a medical reason. So but if you think about the sort of hormone change for an induced menopause, that's your hormones dropping overnight really, really suddenly. So it's almost the most extreme form of menopause you could have. But what we found, like, you know, it's probably about 10%, 5 to 10% of women have that kind of menopause. The rest of us have a non-induced menopause, where your hormone levels sort of bounce up and down during perimenopause, and then they fall as your periods stop, and then level off at a lower level. And actually the symptom profile for those women, so in perimenopause, is really different. And symptoms like joint pain, brain fog, sleep problems are more common than hot flushes, and they're more impactful on people's lives. So we're actually seeing like a different pattern to the research emerging. And although, you know, this isn't, I should definitely say, this isn't like a clinically valid study, it is interesting that, you know, we might be looking at menopause based on a type of menopause, but not the most common type of menopause. And I think that sort of shows that there's quite a long way to go in terms of understanding what women are going through in midlife. And then the other, I think, really revealing thing is we ask about treatment options that people are aware of or they want to know more about. And, you know, 2/3 of the women that answered this question just said they didn't know. They, out of HRT, CBT, diet, lifestyle, supplements, they just didn't know what they were interested in. And I think that reflects just a huge gap in education and information. Next slide to Katie.
Thank you. So this slide is kind of just running through some of the women that we've spoken to. As it's been touched on before, I think at Medway around 52% of women are going through some kind of menopausal stage. And often when we've spoken to women, it feels like they're alone, because obviously it's such a stigmatized topic. Women don't often talk to each other about it, and they kind of just try and muddle through. And actually it often hits at a time where people are at the peak of their career or going through other challenging times in their life, and is a real struggle. And actually there's been a high proportion of women we've spoken to who are either in the healthcare service or in kind of police or in teaching. And it's kind of a problem that they're just trying to deal with by themselves. Julie was a lovely woman we spoke to from Wales who said that she worked in a hospital. She's kind of quite open and really lovely, and was talking to us about it, and said she tried to talk about it to people, but you know, people would be willing to just talk a bit about hot flushes and laugh it off, but weren't really open to talking any more about it. And she wants to feel kind of less alone, and she kept saying she wants to feel more herself again. She'd kind of lost her identity. She found it really difficult at work. She worked in theatres and found that it was really hot, and there wasn't even a place to kind of even trying to go and sit down for a minute. The hot flushes were just unbearable, and she was really struggling with work. Angie was another nurse that we spoke to who had to take 2 months off because she felt so awful. And I think this is a really important point, because I think with the stigma comes the difficulty of actually talking to a manager about symptoms that women are going through, not being able to feel comfortable, you know, talking to occupational health about actually really struggling with these symptoms. And these symptoms are due to a real, you know, deficiency, like estrogen has massively dropped in your body. If you think about like a vitamin, B12 vitamin, if it drops, you can take a supplement. Estrogen is kind of similar. If it's falling away and you're getting these awful symptoms, we should be able to talk about it and do something about it and help. And then Sharon, this actually reminds me of my stepmom, but said the brain fog is really terrible. She was basically finding it really hard to run a service. And when you think about, you know, often this is hitting women who, when they've got finally to like a leadership position, it's particularly devastating. And from kind of personal experience and also from in clinics, I've seen women who finally feel like they've kind of got to where they want to be, but then are suddenly crippled by feeling that they need to quit because they don't have the confidence. They suddenly find they're stood up in a meeting and can't remember what they were going to say, or they really need to leave because they're having a flush but don't really know what to do about it. So we have really found that this is affecting a lot of women, and is certainly something we need to do something about. Back to Annie.
Yeah, so just to add to what Katie's saying, you know, there has been a lot more interest in menopause in the last kind of 12 months. And, you know, recently the BMA did a study of female doctors, 2,000 female doctors, and they found that in that study, 90% of women said that they'd been significantly affected by their menopause at work, and 2/5 said that they didn't feel able to adapt their working life or their working patterns at all to make the changes they needed to accommodate their menopause symptoms. And I think it was really revealing that only 16% of these women had actually discussed menopause with their managers. And so the consequences, like more broadly, are that women do feel really negatively affected at work, often consider quitting, sadly quit across, you know, the board at quite high numbers. And when you consider what Katie said about this is the kind of peak and pinnacle of their careers, often, you know, what you're getting is a leadership vacuum, and you're getting a female leadership vacuum. And if we think about the potential ramifications of that in terms of, you know, leadership being representative and people having role models to look up to, that's like a wider problem that kind of trickles down from the impact of menopause in the workplace. And I can, you know, personally say on the journey of Alva that one of the kind of most shocking and impactful things for me, beyond my mum being a GP and having an induced menopause and not realizing for 4 years what her symptoms were from, beyond like that personal connection, it was one of my former bosses telling me that she had considered leaving. She was a partner in a consulting firm, and she'd considered leaving her job because of the menopause, and she didn't feel able to tell anyone. And she really was at the top of her career, and she was a huge influence on everything I've done to date, probably the single person I look up to the most. And I thought, wow, if she'd left when I was there, I just wouldn't be doing what I'm doing today, and I wouldn't have felt, you know, confident and empowered in my early professional life to kind of try and make positive changes. And so I think women are suffering, but also there are these kind of wider consequences. So I guess that leads us on to the last slide, which Katie's gonna take and then lead into a discussion.
Yeah, and I just wanted to add a little bit more to what Annie was just saying, because we've spoken a lot about women, but obviously this also impacts everyone around them. So partners, family, children, you know, I can think of ways it's affected me and my family, and I'm sure everyone's in some way will have been touched by it, but maybe not. There won't have been that open dialogue. So I think hopefully, you know, events like this and keeping talking about it will help everyone, not just women, but also their partners and their families. But more specifically, I think it's going to be kind of useful to talk a bit more about how workplaces can help. And some workplaces are not doing anything at the moment, and some are doing a lot to help. So I thought it'd be a good time to kind of talk through what Medway currently has and how what other support women feel might be helpful at this time. So I'm going to open this up kind of for questions, I think, at this point.
Thank you, Katie and Annie. That's a very, I mean, just listening to it, I'm just thinking I'm not going mad, because I can identify with so many of the symptoms, and actually it's quite nice to hear that I'm not going mad because you're saying it's because of the menopause. On the questions, we've got a couple of themes going through them and reading through. Some of them are quite very sad. We're going to the GP and pushing antidepressants, saying this is depression and not the menopause. What would your advice be to people, to ladies going to see their GP, feeling that it's menopause, but being suggested that actually it's depression and they should be on antidepressants? Shall I get Katie? Would you like to answer that one?
Yes,
GP.
happy to. So well, firstly, I'm really sorry that that's happened, and not trying to support GPs in any way here, but I think there's a theme, which is a 10-minute consultation is never going to be long enough to discuss these issues, and it doesn't mean that prescribing antidepressants is right at all. But I think just persisting, so going back and saying, no, I don't feel comfortable with this. Actually, like, I've done my own research, and I think this is the menopause, and you know, these are the things that I feel I want to try, and I'm not comfortable with antidepressants. I'm not saying at all that it should be that way. I think we're in a really challenging time, and that's something that we're trying to solve as well at Alva, in terms of education, not only of empowering women themselves, but also educating health professionals. Because, I mean, there is kind of a variation in what GPs know and are taught, and that is improving. But sometimes it means that you kind of just have to go in yourself and say, no, actually, like, I think these are my symptoms, and I would like to talk to you about treatment for menopause, or at least trying some treatment for those symptoms.
Do antidepressants have any role to play? Do they have a place, or can they make things worse? Or, you know, if you are menopausal with no depression, can that have a negative effect in your treatment?
So this is a really hard one, because I think it's such an individualized approach. So it's so dependent on the woman and kind of what she's experiencing at the time. I certainly think that antidepressants are not always the wrong treatment. So there is an overlap in symptoms between depression at that point in a woman's life, and also the menopausal transition. But I certainly think jumping straight to antidepressants is possibly not, well, I don't think is the right route. They do certainly have a place, you know, particularly if women, for whatever reason, aren't suitable for hormone replacement therapy, or, you know, there are other things going on. And I think the most important thing is taking it on an individualized basis and making sure that the right decision is made for that person. And it may be that isn't done in 10 minutes. That's kind of going back a couple of times, or asking for a double appointment at the GP, which I know can be a challenge as well.
Thank you. A comment from Harvey, Jack and David, who are sitting together and say they're wearing masks. They wanted us to know that. Shocking statistics, and often difficult to talk about. What could we do practically here at MFT to open up the conversation about this amongst our workforce? How could men, us, be better allies? And there was another question, I think they're from a manager, saying, what as managers can we do practically to help, rather than just be understanding and sympathetic? Annie, would you like to take that question?
Yeah, definitely. I mean, I really do think that conversations like this are a great first step, because it normalizes what is a very taboo subject, and also it gives people an event or a conversation to lean on in terms of contextualizing the way that they're feeling. But the other things I think that employers can do is you have a menopause policy, make sure it's enforced. I assume that would mean giving managers some kind of training on menopause, and that includes like how to bring it up and how to approach it, not just expecting the women to be able to bring it up themselves. And that again it's not an easy thing on an individual level to do, but it is just about normalizing this conversation. And I think we've got to a place in the workforce where, you know, if you thought someone you were managing was really low, you could check in and say, are you all right? And I think, you know, it is just it's the next question after that, and it is really kind of normalizing that conversation. I think the other kind of practical things that people can do are create kind of safe spaces for women to connect and talk to other women about what they're going through, whether that's kind of an informal coffee morning, or whether it is something kind of more formalized on a regular basis. I think that men, our experience of speaking to men about menopause is that they want to learn, and because they want to empathize. And I think everyone has a job to do to understand that to gain empathy, you have to understand the problem a little bit more. So I would say that making sure that men are informed enough to empathize and have conversations about it is really important. And actually, you know, I think that there's a lot of goodwill there within the male workforce to give support, but it is just enabling men a little bit with education to understand what this experience is actually like for women. I don't know, Katie, is there anything kind of, you've worked in a hospital setting more than me, is there anything that you think relates specifically to like working in a trust that they could do?
Do you know what, I think I don't want to be negative, but I think it's almost more of a challenge because inevitably in healthcare, you're in a rota system, which is always, fairly short-staffed and therefore flexible working hours and things which may be more appropriate in other settings and more difficult to manage, particularly breaks. So often people in other settings use short breaks and cool rooms, and that may be more challenging in certain healthcare environments. But I think what's really important is if managers feel that they can't talk about it, is at least giving women access to speak to occupational health to figure out if there are ways that for more flexible working and more support whilst they're at work. Yeah, that's
the menopause policy that we have here at Medway does allow for the conversation to see if any reasonable adjustments can be made, like coming in later to work or being able to have a fan and things like that. That's not always practical. And as we discussed on Monday, the issues of PPE are just compounding this, having to wear layers of masks and plastic, making it worse. And someone's pointed out on the chat here, how can you have a conversation about this with a male manager who is young enough to be your son? And I really can empathise with that. What are your comments on that?
So I think it's really interesting because we've had parallels with speaking to investors and young doctors as well who kind of challenge what we're doing, but again, I think actually there's a sort of generational thing where with mental health, if we take it as a kind of parallel, in the last 5 to 10 years, we have really opened up and started talking a lot more about our mental health. And obviously it's not universal and there's still ways to go, but people do kind of understand that taking proactive steps to look after your mental health is a really important part of overall well-being. And I think, the menopause can be likened to that, and it's like it is about taking proactive and preventative steps. And I think if you create these parallels potentially when you're talking to people who seem like they might not understand, often they actually do kind of twig and get it because you put it in a context which they have a better understanding of. But again, I think it is all about using those areas of kind of overlap and trying to help educate and help create empathy between people who are really different. And certainly I do think that with the mental health symptoms, that is a really good common ground, because if we think about really terrible anxiety, which is a very, very common symptom of menopause, actually, although they might not have experienced the kind of wave of unexplained anxiety that menopausal women do, a lot of young men have experienced crippling anxiety at some point, and creating that space to say, actually, this is how it sometimes feels. Do you understand? Can be really powerful. Not easy, I should say, but a very powerful thing.
I mean, yeah, I can understand the difficulty being a male manager. And then trying to explain all the symptoms away to women's problems, menopause, and actually getting into trouble with that, and other women getting upset. So it's how that conversation is taken gently to try and introduce it. And I can see how difficult it would be. An interesting question here is, what role does ethnicity play? Katie, you're nodding. Would you like to answer that one?
Yeah, I mean, there is some research showing that ethnicity plays a big role in menopause, and that women of different ethnicities experience symptoms in a different way. It's certainly something that we want to look into longer term with Alva, because we think, there are certain ethnicities that don't experience hot flushes as a normal symptom, and those women are therefore kind of just left with certain ethnicities just experience more shoulder pain and muscle aches and fatigue. So I think it is really important to be aware that different ethnicities present differently in menopause, and it's something we're trying to kind of improve education on, I guess. I don't know whether you want to add anything, Annie, because
I think we as with every part of health, the kind of socioeconomic factors that play into how people engage healthcare have a role to play here as well. And I think, as Katie said, it is really interesting. There's early data on certain ethnicities having earlier menopauses, having different symptoms, but then also some ethnicities kind of linguistically not having words to explain certain symptoms, or not having the kind of vernacular or the kind of cultural acceptance of explaining some of these symptoms to medical professionals. And I think that leads to real changes in the way care is offered to different ethnicities. And it is something that's not, as Katie said, it's not like really well understood, but there is like quite a lot of emerging data on different ethnicities experiencing menopause quite differently. So definitely something that, with a platform like Alva that is more digital, if people want to share their ethnicity with us, I think that is something that we would really like to be able to look at, whether the symptom profile is different, whether people describe it differently, and whether they access treatment differently as well.
Jenny asks an interesting question here. Is there anything we can do pre-perimenopause in terms of lifestyle changes to prepare, such as diet, exercise, natural health supplements? Because of course not everyone can tolerate HRT or actually wants to take HRT with the risks that are associated. What else can we do, please?
So it's a difficult question because there's not that much. I mean, there is research, as Annie was saying before, around induced menopause, but there really isn't strong evidence out there in terms of kind of more preventative measures. I think associated with the estrogen decline, which comes with menopause, are things like increasing your cardiovascular risk factors and osteoporosis and things like that. So I guess my advice would be looking at those, kind of trying to keep yourself as healthy and kind of fit as you possibly can before you get to the menopause, to like ensure you have the best bone strength and those kind of things. But I still think there's more evidence that we need in terms of more lifestyle type approaches for this.
Yeah. I think there are some lifestyle and diet things that are also triggers when you get to menopause. So lots of women find that alcohol triggers their menopause. Smoking in general is not a good thing to do in terms of you can have, I think, an earlier menopause, can't you, if you smoke? So there are the kind of, I guess, quite standard good practices for lifestyle advice, just like trying to maintain a balanced lifestyle. But as Katie says, more research is needed, because we do speak to a lot of women, and we should not underplay how many women do find solace in alternative therapies, lifestyle changes, and also CBT and mindfulness, and taking more time to really care for your mental health proactively can have a really big impact. And although there's not a huge availability of CBT specific to menopause in the UK at the moment, I think that is something that we will see change, and it's a great option for women who can't take HRT.
So I'm going to wrap up two into the one question, because it's the last question, but they sort of link together. How long do I have to wait before I discuss HRT with my GP? My periods have been irregular for around 6 months, nothing for 2 months, and hot flushes. With another lady saying, I'm really struggling with the perimenopause. I'm 43 and being told I'm too young. So it's that, how long do you wait when you're starting to have symptoms and then being pushed away, being told you're too young? I think they sort of wrap in together as to how to answer that. Annie, would you like to answer that?
I'll do the non-clinical and then Katie can do the clinical. I would say, unfortunately, you have to be a bit persistent potentially with healthcare. But if you know that you are struggling, you deserve help and you're not making it up. And there is no kind of age that is too young to be talking to healthcare professionals about these symptoms, especially if they're having a big impact on your life. So I would say, I'm really sorry that you're struggling. And I'm also sorry that engaging healthcare hasn't been easy. But unfortunately, you're really not alone in that. That is the case for lots of women that we speak to. But if you keep trying, and if you turn up at your GP appointment as educated as possible on what you think you're going through and what you think your options are, that will help the GP help you in those short time scales. So I'm always going to say, arm yourself with education and keep going, because you're not making it up, and you will get there. Now I'll let Katie do the other side of the coin. I'm the patient, she's the doctor.
I want to kind of mirror a bit what Annie has said, and that I'm really sorry that potentially you've had a bad experience with healthcare, and I think it is a real struggle. I actually don't think any time is too soon. I would much rather my patients talk to me as soon as they feel they need to, because actually this, like Annie said, you're not making this up. And if it's having an impact upon your life, we are kind of here to try and improve those things for you. Certainly the woman who mentioned irregular periods, hot flushes, there's no reason that you shouldn't be assessed for HRT at this point, but obviously it all comes down to personal risk factors. And again, I would say talk to your GP about it, go armed with the information, any information that you have, and just have the discussion. And if that has to be, you know, some doctors want to see kind of periods having stopped for around 6 months because there's certain licensing around HRT, and others are slightly more comfortable with starting it a bit earlier. So again, it can be clinician dependent, but just keep going with it because your symptoms are real. I don't think age really should come into it. I think if there's any doubt around the symptoms and your period changing, then at least it's difficult because often blood tests and things are not indicated. But if there's any question around symptoms and diagnosis, particularly at a young age, I think it's actually more important to talk to your GP, because we know that treating menopause, if you're experiencing an early menopause, which is before the age of 45, or a premature ovarian insufficiency, which is menopause before the age of 40, that actually hormone replacement, if you can take it, is exceptionally important and is actually needed. So I think I would try and talk to a health professional about it. It's not too soon, but I know, again, it's easier said than done.
Yeah, and just on that, you're right to bring up kind of early menopause and POI, because actually they're more common than you'd think. You know, 5% of women in the age range of 40 to 45 will go through their menopause. That's an early menopause, and it's 1% of women, I think, under 40 will have a menopause. So it's not a small number of people that have these conditions. You know, it's a lot of women, and I think it's just the taboo surrounding the conversations that are stopping us from opening up and actually talking about it when we're younger, and these conditions that affect younger women as well.
Thank you so much, Annie and Katie, for joining us today. I've learned so much, and I'm sure that everyone listening has, whether that's male or female, learning about the menopause. And thanks. Sorry if we didn't get to your questions, because there were so many questions here. The webinar will be on YouTube. It takes about 5 to 7 days for any of our colleagues that haven't been able to listen to it, and that you feel will be useful for them to join and listen. If you head to the Medway Innovation Institute website, that's on medwayinnovationinstitute.com, or to the Twitter MFT Innovation, you'll be able to pick up the links for that. I mean, my take from this is, why do we have this stigma? We need to break the stigma. It's beneficial to us as the employees, and it's also beneficial to the employer if they manage to do this, to get more out of us, because we are in that time in our life when we can be achieving so much. So we need to make menopause more glamorous. Thank you very much, everyone.
Thank you so much for having us.
Thank you
for joining.